All right, welcome everyone. My name is Becky Sanders. I'm the program director for the Upper Midwest Telehealth Resource Center. Jefferson. Okay, thank you. Um, my name is Becky Sanders. I'm the program director for the Upper Midwest Telehealth Resource Center. Thank you for joining us today. Today, Cam Hilt and I are going to be talking about remote patient monitoring during our virtual office hours session. So during virtual office hours, we have a smaller group and we like it to be a little bit more interactive. We do have a slide deck that we're going to share today, but then we ask that you go ahead and jump in with questions and we will take those as we go along. And without further ado, I think we're going to go ahead and get started. We are recording today's session, and Carolyn will send out an email when we get that posted so that you can view that at a later time. And that will be available through our YouTube channel and also on the archived events on our website. All right. So we have three objectives that we're going to cover today. Can patients with chronic conditions be effectively managed from home? And I hope that you'll agree and say yes once we get to the end of today's discussion. And then what technologies are available to do this? We'll be talking about some different technologies. As a telehealth resource center with federal funding, we do have to stay vendor agnostic. So we're going to share some information from three different vendor perspectives of vendors that we have talked about, but also realize these are not the only vendors that do remote patient monitoring and have products. These are just three that we've talked to. And then we'll wrap up with some reimbursement. Also, we understand that technology is wonderful and can do many things, but if your providers can't get reimbursed, then it's probably a no-go within your organization. All right, so I've talked a little bit about the Upper Midwest Telehealth Resource Center. We are one of 12 regional telehealth resource centers around the country. You can see us in the lilac states. We cover the 4 states of Illinois, Indiana, Michigan, and Ohio. And there also are 2 national telehealth resource centers, one for policy and one for technology. The 14 of us come together very collaboratively. We do have a national website and a regular monthly webinar series that you can access through this website. And there's also an interactive map here that you can reach out to any of the telehealth resource centers across the nation through that map and get into their own individual websites. And even before COVID, we really felt like we were virtual librarians. So much of what we do is to interface with folks via email, on the phone, all of the conferences and the normal networking events that we enjoy so much as we travel around our region and the country have not happened with COVID-19 and where we see ourselves now with the public health emergency. So we are truly virtual librarians these days. There are several ways that you can connect with us. I mentioned through our website, there's an info@umtrc.org. And that email is monitored by one of our other associates, Luke Wortley, who is usually our frontline person to answer our technical assistance questions. So we have resources available on our website, and we also have a Facebook page and a LinkedIn page where you can like and follow us there. All right, so we are now going to start on objective 1, and I'm going to hand things over to Cameron Hilt.
All right, thank you, Becky. So as we stated before, our first objective is to really see, so can patients with chronic conditions be effectively managed from home? So in order for the UMTRC, we wanted to be able to dive into what are some real vendors that are providing RPM services doing, and what are some of their results that they had after they implemented. So we talked with 3 vendors, the first being Care Innovations, the second being Dictum Health, and the third being Vivify Health. And so we really wanted to see what they've done in the past with providers with this. So the first is Care Innovations. So after their first year of implementation, RPM program for the UMMC Mississippi Diabetes Telehealth Network, they found that of the 100 patients that engaged in their RPM program, that they had 0 hospitalizations and ER visits. Additionally, these diabetics had an average A1C reduction of 1.7%, and they actually accrued a total annual cost savings of $339,000 on those 100 diabetic patients. Looking at a case study from Dictum Health, they implemented their RPM solution with a children's hospital in Virginia. And what they found by using RPM, they were actually able to improve their early discharge from the inpatient setting up to 12 to 24 hours. There were 0 unplanned returns to the hospital. There was a 92% patient acceptance rate for telehealth visits. They produced savings in patients' travel, because especially within a children's hospital, some people are traveling as far as 5 hours away to get their kids to the specialized care at their facility. And lastly, it improved clinic efficiency and reduced the number of no-shows within the hospital. Now, our third and final vendor, Vivify Health, actually deployed their RPM solution focusing on congestive heart failure patients at the University of Pittsburgh Medical Center. And so of the members that engaged in this program that were 65 and older, are now 74% less likely to be readmitted to the hospital within 90 days of discharge. Medicare patients enrolled were 76% less likely to be readmitted, and over 92% of the patients were compliant with the program. Now, really, we showed this as just a snippet of the slowly rising evidence base for remote patient monitoring. As Becky said before, these are not the only vendors providing these services. These were just the vendors that we engaged with. But hopefully just these few case studies really demonstrate that RPM really can have such an impact on patient care and improving quality of care while also reducing costs. So if you're interested, continue to look into that research, but we wanted to give you at least a little bit of an overview of some of these clear findings that we found with these vendors that we've engaged. But really this starts to beg the question, so what technologies are actually available to do remote patient monitoring within these organizations? And so I want to clarify first that Medicare has its own specific requirements when it comes to the devices that would fall and be billable for remote patient monitoring. So for Medicare, it is a requirement that the device meets the FDA's definition of a medical device. So this is described in 201H of the Federal Food, Drug, and Cosmetic Act. Additionally, for Medicare, they do require that the device automatically uploads patient data, and it's not something that is manually entered by the patient alone. But really, there's lots of different options for RPM. So they typically come in 3 ways. So the first being a personalized home kit or health kit. The second being a mobile application or a bring your own device delivery. And the third being an interactive voice response. Now, all 3 of these different methods to administer RPM services typically come paired with peripheral devices. So these can be weight scales, blood pressure cuffs, pulse oximeters, barometers, stethoscopes, etc. And those peripheral devices are usually chosen based off of whatever condition is being monitored. So if you're working with a congestive heart failure patient, they may have a blood pressure cuff that they're continually getting readings on and sending to their provider. All 3 of these deliveries have their own pros and cons. So for a personalized home health kit, one of the huge benefits of that is it actually comes with its own tablet as well as the peripheral devices. So especially if you're working with an area where technology access is a barrier, a home health kit could be a huge resource or asset for communities that may not have easy access to a smartphone, as well as some of these health kits actually come with delivery setup. So if you're working with patients where technology literacy is a barrier, you do have some of that extra support that's offered by those vendors to help set it up and have a device that's specifically used just for the purpose of patient monitoring. The drawback of that is because it's more equipment, more setup, it can be more costly. Whereas a cheaper solution is more so of the bring your own device or interactive voice response. So both of those are cheaper solutions, but they do kind of rely on that the patient has some sort of technology literacy, or they have easy access to either a smartphone or a telephone in order to be able to actually input their data through that. And so just to give you a little bit of a visual representation, this is what some of the home kits look like for the 3 vendors that we have referenced. So you can see that there are some slight differences in what they come in or how they're set up, but that they're all pretty much consist of the tablet along with the peripheral devices that match up with the condition that's being monitored. So through working with these vendors, there's some notable capabilities that these RPM programs are really able to offer for you. The first is that all of these have a provider portal. And so within the provider portal, you're actually able to set up clinical alerts that are based off of the patient that you're tracking. So using the example of diabetes, if you're wanting to know whenever a patient takes their A1C, if it's in a high range, what these clinical alerts will do is you can actually set the sensitivity level so that you're not constantly getting alerts. But you can set the sensitivity level so that whenever a provider goes into that portal, that patient will actually be moved to the top of their priority list so they can ensure that they're actually following up with that patient and following up with the patients that need the most help quicker. Additionally, they have their own reporting capabilities. So this could be really anything that you would want. They have patient tracking, they have breaking it out by disease, or just any additional data that you would want to drill into specifically. Most of these RPM programs are offering those reporting pieces. As well as they will help with logistics and in-home kit delivery and installation. So as I said before, especially for those home kits, that can be a really great way to set up working with patients that have technology barriers or have difficulty utilizing their technology devices. Another important feature is that they do actually track patient interactions. And so for a provider, and Becky's going to dive into this a little bit more in the billing section, but for billing, tracking the time interacting with a patient is essential for getting reimbursed for those services. So the benefit that these vendors can provide is that that tracking is actually done automatically. It doesn't fall upon the provider to actually track all the minutes that they spend engaging with that patient. And then lastly is billing support. So there is a variety of levels of billing support that these RPM vendors can provide. Some is as much as the patient interaction tracking, and then some will actually go so far as telling you, based off of the services that were delivered, these are the codes that you would bill for. So especially in areas where maybe you don't have as much billing support, working with vendors that have those more in-depth options may be a better fit for you if that's a capability that's important for you. So really, with all of those things in mind, we wanted to talk through a little bit of what are some of the best practices if you're thinking of implementing a remote patient monitoring program within your organization. What are some of the things that you really want to think through before actually implementing that? And so the first is that you really want to identify a focus area. So the ways that you can do this is really by following the data. So if you have billing data or EMR data that you can look at to really see what are some of the trends of the conditions that are really impacting your organization, as well as what are some of the gaps in quality that a program like our RPM could really fill that gap. And additionally, if you're a provider, you already kind of have an in-depth knowledge of maybe what are some of the challenges that your patients are facing, but maybe collect feedback from other providers to see what are the conditions that they're really struggling to deal with. Or if you're not a provider at all, making sure that you get the perspective from those frontline workers before moving forward with a program such as this. The second is after identifying that focus area, really prioritizing the problems that were identified. So, what are some of the biggest gaps? What are some of the areas where there's the largest concern for patient quality, as well as the most upside for potential savings? And so, really start to think through what problems need to be prioritized first, and then really envision what those expected outcomes could be. So for congestive heart failure patients, we already talked briefly above with one of our vendors where they used that program and they were specifically able to reduce the readmission rates for their congestive heart failure patients. And so really start to think through what are some of the expected outcomes that I have through implementing this program. And then lastly, getting into evaluating the vendors in and of themselves and their fit to the particular problem that you want to address with remote patient monitoring. And so just a few questions to think through. If you are already kind of have done those first few steps, you're starting to look into different vendor options. Some things to consider is first, how long has this vendor been doing remote patient monitoring? I'm sure if any of you have worked with technology vendors in the past, the amount of options is overwhelming. There's so many different vendors out there. There's lots of new startups that are doing really innovative things, but you need to really weigh out what is your comfortability with working with potentially a startup. If you do all this time to implement the program, get all the technology, and potentially that funding for that startup falls through, you need to either be okay with that, or you need to look to working with vendors that have more of a history of working and in RPM and have more financial stability. So this is something based off your organization to consider your comfortability with working with more startup companies or working with vendors that have been here for a long period of time. The second is that based off of your problems, ensuring that that vendor has a specific solution in mind that will address what you really need. And so most of these vendors have a wide variety of different conditions that they will cover. So some of the more common being diabetes and COPD or congestive heart failure. But if you identify something different than maybe those more common issues, you just want to make sure that the vendor has a specific solution for that. You also want to know if they have any notable case studies or if they've worked with any clients in your areas. This will just help you get a better feel of, are they a best fit for our organization? Are they familiar with working with other providers that are similar to us, either in demographic or in size? And then lastly, evaluate how much billing support you need. So if you need a lot of billing support in order to be able to implement a remote patient monitoring program, ensure that you're working with vendors that are able to support you in that way, and maybe do above and beyond just doing the patient interaction, but will actually give you guidance on what codes to bill. If you already have a department that does that, it may not be as important for you, so it may not be something that you have to evaluate as closely. But for those of you who maybe that's a more urgent need, that's really a good focus point to hone in on. And so with that, I'm going to hand it back over to Becky, and she's going to dive into a little bit more of how do you actually get reimbursed for these services.
Thanks, Cam. So our final objective for today is reimbursement. This has been quite a year for changes. The world of telehealth, I I should have put this slide in. At the Upper Midwest Telehealth Resource Center over the last 10 years, I felt like we are paddling this little rowboat in the middle of Lake Michigan. But now with the global pandemic, it's more like we're driving a cruise ship, and there's so many more folks, programs interested in telehealth. So with the COVID pandemic, in March, April timeframe, we saw over 80 new CPT codes added by Medicare for reimbursement via telehealth. The addition of audio-only codes, especially for seniors that didn't have smartphones or tablets or computer access, um, and the elimination of geographic barriers for folks to be seen from home instead of at a specific clinical location. Also, we saw expanded roles for occupational therapists, physical therapists, and speech language pathologists to perform services via telehealth for the very first time, and many, many, many other waivers. So in August of this year, the CMS put out their proposed physician fee schedule, and this normally happens in the summer each year. Um, this is just a snippet. Here's a link to it. We could spend an hour just talking about the proposed physician fee schedule, but it gives you an idea of what CMS is proposing for the following calendar year and asks for feedback. Now, the feedback time frame has passed, and historically we hear mid to late December what the final proposed physician fee schedule is going to be. So hopefully in about a month, we'll know that for sure. And they do discuss RPM in some of the physician fee schedule. So you can certainly take a look at that. But some takeaways right now, from the Medicare perspective at the federal level, RPM is really designed for patients with acute conditions, but also those with chronic conditions. Now, there's a whole nother set and whole nother topic about billing for chronic care management that we don't have time to get into today, but that is available as well. So in the 2021 proposed fee schedule, it does limit RPM reimbursement for services to existing patients. But right now, during the COVID-19 waiver, or the COVID-19 public health emergency, that has been waived. So even new patients can be seen and billed for remote patient management during the public health emergency. The billing for Medicare reimbursement is at least 16 days over a 30-day period. And then this, the CPT code here, 99453, can only bill once per episode of care. So what are those CPT codes? Here are the most common CPT codes for physician remote monitoring or RPM, remote patient monitoring. And I'm not going to read them. You'll have access to these slides and through the recording, but I wanted to just give you the information here. You see that this is billed each 30 days. You know, this is initial patient use. This is collection of data. And then there is an additional code here, similar to the way chronic care management is developed, that there's additional time that can be billed. So the first code here, 99457, is for the first 20 minutes. And then if there's an additional 20 minutes during that 30-day period, then you can bill the additional code. Now, switching from Medicare reimbursement to Medicaid reimbursement, each state is a little bit different. We do have some commonality between Indiana and Illinois. Right now, the way that the policies stand for those two state Medicaid programs is you have to be a licensed home health agency to able to perform and get reimbursed for RPM. You have to have 2 or more events relating to an ER visit or an ED visit or an inpatient hospital stay sometime in the previous 12 months. And they're limited to these 3 diagnoses: COPD, CHF for diabetes, which happen to be the largest percentage of chronic care conditions in the United States as well. They have to be provided by a registered nurse or with an order from a physician, and they're subject to prior authorization. In Ohio and Michigan, they currently do not have any reimbursement for remote patient monitoring. So that's, if you're in one of those two states, something to think about. And certainly avenues exist. We can connect you with folks to advocate for that in the future. All right. So some of the resources that we put out on our website, a lot of it is around reimbursement. I don't know, Cam, off the top of my head, I would guess 80 to 90% of our questions are about reimbursement. I don't know if you've got that number. Yeah, is that about right? So we've dedicated a lot of time to creating resources on our website for this. FQHC and RHC billing is just a little bit different from hospital billing. So for each of our states, we have two different reimbursement resources where we talk, it's a summary of all the resources and links to the various Medicare and Medicaid policies, both from the FQHC, RHC perspective and from the hospital perspective. So you're welcome to check those out. And here is our contact information if you want to follow up with Cam or I. And at this point, we're going to open things up for questions. You can either chat your questions or unmute yourself and ask them live.
Hi, Becky. This is Laura Foyle from Michigan Medicaid. Just wanted to make a slight clarification. So our policy regarding remote patient monitoring is slightly confusing because we actually do cover the service. We actually cover 99453, 454, 457, and 458 codes. But we don't have those specifically outlined in our telemedicine section of our Medicaid provider manual. So these have always fallen under our physician services sort of area. So we actually have them on our physician fee schedule. So as long as providers use, are billing the codes as appropriate to the code description, then they are allowable services. So I just want to point that out. I realize we are highly confusing when it comes to our telemedicine policy. We're working very hard to update this and to make sure it's more comprehensive. But prior to kind of this upswing in telemedicine, we never specifically defined remote patient monitoring under telemedicine, but it does exist within our physician fee schedule, and we actually do reimburse for the services.
All right. Well, thank you very much for letting us know. We will be certain to update all of our information.
Yeah,
we'll find it. I'll find it. I'll find that link. If you want to send us the link to that physician fee schedule, we'll pop that in our resources.
And keep your eyes open because we'll be putting out some new stuff.
Yeah, you guys had some great stuff come forward. You were trying to do some great changes with Medicaid, and then the coronavirus hit, but you still got everything in at the end of June. A lot of changes.
Yeah, we've been working really hard in Michigan. We have a number of, I'm sure you've seen, and I know you've referenced a lot of our temporary bulletins that are out there for telemedicine. We're currently looking at what our long-term policy is going to look like. And a lot of that has to do with reorganizing how our information is shared so it's clear. And then looking at what we've expanded, due to the pandemic and what we want to see moving forward. So it's definitely a work in progress. We're working hard on it. But yes, definitely wanted folks to know that it is a covered service, and we'll be clearer about it in the future.
Okay. Thank you so much, Laura.
Yeah, sure.
And along those lines, I should also give props. I don't know if we have anybody from Ohio on the call today, but they just, let's see, today's the 20th, 5 days ago, they implemented some changes to Ohio Medicaid in regards to the pandemic and opening up some stuff that had come out through bulletins and waivers during the pandemic and made those permanent. So hopefully we'll see some new changes there as well. Additional questions? We still have just a few minutes remaining for our time today. All right. Oh, Cam, I didn't copy down the link. Do we want to do our survey today?
Yep. So Briefly here, I'm gonna just post a brief post survey. So this just helps us to ensure that we're really covering the topics that are most helpful and for you, and just to get some general feedback if there's anything in particular you're wanting to look at in the future. So if you could take just a few moments to fill out this survey, we would greatly appreciate it.
Thank you very much. It's Cam's job to keep us on track and make sure we document all of the great things that we're doing and reporting that on a timely basis to our funders. So we appreciate your taking just a minute or two to fill that out. And that link is now in the chat. If there are no further questions, we're going to go ahead and end today's session. I wish everyone a very happy weekend. Hopefully we'll see some sunshine and a very happy Thanksgiving. Thank you.
Thank you.